Professor Peter Martins Ndume. Sunrise December 1, 1954. Sunset May 14, 2013. Professor Peter Martins Ndume, also known as Simon Templar, the Saint, was born to Pa Peter Ndume Kepe and Ma Fani Kepe on December 1, 1954 in Bonge, Southwest Region, Cameroon. He attended the CDC Primary School Bota from 1958 to 65 and later enrolled into Cameroon Protestant College, Bali, where he was assigned to the O'Neill House and spent 5 years. He was amongst the top 10 in his class and loved sports and read passionately. He would go on to obtain his ordinary levels in 1970 and his high school diploma from Casbambili 2 years later. He enrolled into the University Centers for Health Sciences, University of Yaoundé in 1973 and would later graduate in 1979 with a degree of Doctor of Medicine avec mention très honorable. Upon his graduation from CUSE, he was appointed the Divisional Chief of Preventive Medicine and Rural Health Services in Donga Mantum Division, Northwest Region, Cameroon, for a year before moving to the London School of Hygiene and Tropical Medicine for postgraduate training at the Institute of Child Health in the University of London between 1981 and 85. He studied and obtained a Master's of Science and a Doctor of Philosophy degrees in medical microbiology and immunology, respectively. In 1984, he became an associate member of the Royal College of Pathologists of the United Kingdom, and in 1990, a chartered biologist and member of the Institute of Biology, London. Professor Ndume had admirable literary skills. He was proficient in both English and the French language and had a minimal grasp of German. In 1986, after brilliantly completing his graduate studies in London, he returned to Cameroon and began a career in medicine, public health, and research. He was appointed to and occupied the position of consultant and head of clinical immunology in the Department of Medicine at the Central Hospital Yaoundé between 1986 and 92. Between 87 and 96, he held the position of chairperson of the research section of the National AIDS Control Committee, Yaoundé. Between 89 and 94, he was the Hepatitis B vaccine project manager at the Ministry of Public Health, Yaoundé. Between 92 and 2007, he headed the Department of Microbiology and Infectious Diseases at the Faculty of Medicine and Biomedical Sciences of the University of Yaoundé 1. In 1995, he became the founding director of CAM Diagnostics, a production unit for rapid testing of HIV, a position he held until 2000. Between 1988 and 1999, Peter held a number of academic positions as technical officer in charge of clinical epidemiology at the Faculty of Medicine, Yaoundé, and as vice dean in charge of research in the Faculty of Medicine as well. Ultimately, from 1999 through 2006, he was dean of the Faculty of Medicine. He was later appointed Pioneer Dean of the Faculty of Medicine in the University of Boya in 2006, a position he held until 2011 when he left and joined the World Health Organization in Brazzaville, Congo. He was also the coordinator of the Social Policy Research Network in West and Central Africa at its Cameroon's coordination office. Professor Peter Martins Ndume also served as Vice Chair of the Scientific Council of the Chantabia International Reference Center for Research on Prevention and Management of HIV in Yaoundé from 2006 to 2012. In this capacity, he rigorously reviewed and researched projects and ensured that they were implemented under acceptable international scientific norms. In his professional life, Professor Ndume benefited from the guidance of noteworthy mentors, amongst whom were Professor Jacob Ngu of blessed memory and former Vice-Chancellor of the University of Yaoundé, Professor Gottlieb Lobet Monekoso, Pioneer Dean of the Medical School of the University of Yaoundé 1, and former Minister of Public Health, Cameroon, and Dr. Joseph Kwanyo, here present. I will call on Dr. Kwanyo to stand up for recognition. Until his passing, Professor Ndume held membership positions in over 20 international professional and academic bodies in Cameroon, the United Kingdom, the United States, and France. His publication list included 3 theses, 86 original articles, 11 monographs, and contribution to 2 books. During his career, he obtained 13 grants and awards from diverse international organizations, ranging from the World Health Organization to the Canadian International Development Agency and the European Union. He also performed 15 national and international consultancies for the WHO, GTZ, and CVI, that's Children's Vaccine Initiative, UNICEF, UNDP, amongst others. Peter's life was not all about work. He had his fun side too. He loved partying and could dance all night at home parties or in the glitzy clubs of London, Yaoundé, Limbe, Paris, Washington DC, Geneva, and Douala. He loved church and was an active congregant of the Presbyterian Church Bastos, Yaoundé, Bota Meadow Farms, Limbe. He served as an elder and lay preacher and was chairman of several church committees. He delivered several church readings and sermons in Yaoundé, Limbe, and elsewhere with fervor and caring. Peter was also a committed Boban who nursed a strong nostalgia for his alma mater, CBC Bali. In this regard, he hosted many Boban Yaoundé chapter meetings, especially during difficult times the chapter went through. He made friends easily, and his attachment and loyalty to his friends was well known and could be seen in the time he took to attend those in mourning, illness, and celebration. Probably the most memorable and most recent professional position he held from May 2011 to May 14, 2013 at his passing was that of the Program Manager for Research, Publication and Library Services at the United Nations World Health Organization Regional Office for Africa in Congo-Brazzaville. Peter Martins Ndume, Simon Templar, the Saint, lived a very fulfilled life and blazed many a trail. His legacy lives on in the many young talent he has grown.